Hi, it's Julien here. I'm here with Brad. We've just been chatting. He's saying he's got a bit of a lower back stuff going on. Nothing in particular. But he plays football a lot. Haven't been a bit off the weight training actually, so
Yeah.
perhaps not enough weight training. But he has been working. He's been working hard here and been on his feet all day. So we'll have a look through that. So see, and I'll kind of focus on the lumbars and running through those. And before I forget, somebody asked a question about techniques that I've done or tests that I've done that are not in the textbook. In Activator, when they used to do their advanced, what are called track 3 classes, they were what called the pink notes, and they were ones that people who there were new tests coming through and were they being validated. Some of those I found useful, some of those less so. So the answer to where are the tests that you see me do that aren't in the textbook, the answer is they were in the pink notes from track 3. I'm sorry I haven't responded to your email, but I've been busy. Been on holiday. Yeah, right. And it turns out I can remember how to sail a 25-foot yacht, so which was good. There we go. Anyway, so let's get stuck in. For those who are regulars of this channel, wow, there we go, will know that Brad is always a right PD and tends to float in the, it's a couple of millimeters there, 0.1 of an inch is how I measure it, not because I insist on inches because of Brexit, it's just because I was taught by Americans and they do everything in inches. Okay, so yeah, definite change with the I'll put stress test the sacrotuberous ligament. So API ilim, just setting the tool to setting 4, and away we go. Get onto that ligament there. Like a lot of footballers, a lot of muscle tissue going on with the glutes for Brad, so you kind of have to dig in a bit there, but try not to linger around that area. Hopefully I don't have to explain that too much. So yeah, it's a practice thing. Squeeze your knees together and let go. Okay, right hand up behind your back. So we all know and love the standard L5 test, which I think is okay. Lateral on the PD side, just one leg. The facet test, a flick. You can also do it one at a time, which is specific to that side. And actually going beyond the 90 degrees, I kind of really exaggerate it here. You can normally tell as you go past to see if there's any change there. So swap your hands around, absolutely nothing going on there. So we got right left rotation, lateral, facets, superior, inferior, position 5. I still get nothing. Arm back down by side. Lift the right hip up off the couch and back down. So jumping straight to the lumbar 3 test, and now I'm getting a little bit of a change, so we're going long on that left side. We can run through the same, and you'll notice that if it's none of those, it actually goes back level again. Yeah. Lift the right hip again, back down. Change, lift the left hip, back down. Actually makes it more. Okay, so everything points to L3 on the left, and do people who regularly play football, for those watching in America, as I've said before, that's soccer to you guys. Then you will see lots of knee problems and you will see lots of L3 problems as well. Both hands up behind your back together. So I'll go a bit quicker now. Actually, when we go L2, there, it's there. Arm back down by side. When you're going beyond the 90, you got a little bit. Anyone who's got a really sore back, it's going to hurt. So be careful pushing too far past it. So slight superior L2. Yeah, you tender in there.
It's not too bad.
Not too bad. How about there?
Yeah, maybe a little bit more.
Okay. So what that was, I was just wondering, I was actually pushing on his L3, I was off by 1. So that tenderness is almost always there if you've got a superior, inferior. So if they're saying no, on thoracics you can be out by 2 or even 3, so it's always worth just checking. Right hand up by your face. Left hand behind your back. And that's just a straight L1, arm back down by side. Do you need to go through all the lumbars every single time? Definitely not. Stick to the basic scan because that will clear it, and then if there's any problems going on there, go back and check the other ones, or anything that's not clearing, go back and check until it does. And I would say if you're adjusting and you're finding the same things come out 3, 4, 5 sessions on the trot, then you probably need to think about getting some imaging because something's a bit more serious is going on. Right hand up by your face. So a big deep breath in and out. Left hand up as well. Both back down by sides. Turn your head to the right. Lift the right shoulder off the couch, back down. Shrug both shoulders up to your ears, down. Squeeze the right elbow, let go. Squeeze the left one, and let go. Right, shrug your shoulders up and roll them back. So that was a right medial left lateral scapular pattern. Head back into the centre. Very common with the right-handers and somebody who has been working hard manually. And yeah, definitely more massages and a busy week for 2 weeks while I've been away. Can't be the gym though, eh? Or perhaps a lack of gymming. Going to the gym? Gymming, is that a thing? Have I just made up a word there? No, I don't know.
Something like that.
Yeah. Lift up your head, back down. Tuck your chin down to your chest, back to centre. Push your face into the couch and let go. Turn your head to the left. And back into the centre. Stretch right hand to right knee. Back round. Left hand to left knee. Back round. Okay. I'm going right QL there. Okay, so all the clues point to knees, so let's check knees. Anterior, posterior, internal, external rotation of tibia. Posterior, proximal fibular head, looks good. Just test it the other way to check, yeah. If you're unsure, you can jump from position 1 to position 2, but the change was pretty clear, to be honest. Always worth checking patellas, so inferior and lateral being the most common, but occasionally you'll find a superior or a medial, but not in this case. Anterior, posterior, internal, there you go, that's the one that changes. Fibular head seems to be okay there. that is definitely an inferior patella. Now, textbook, it's turn over and do it from that way. Well, just a little bit of an easy one. If you can clearly feel the inferior patella from underneath, you can do it from this position. If you're getting it right, you should feel that tendon jump, and be careful because occasionally you'll hit right on that reflex point and they'll kick you in the face. They won't mean to, and they don't mean anything by it, but it might happen, so be careful. Okay, see you next time. Oh, subscribe, like, all of that.
YouTubey things.
YouTubey things.
Yeah.
YouTubey things. Do the YouTubey things.